Hi, my name is Felix. Aikhionbare. The title, Molecular Modeling Mechanisms of SARS-CoV-2 Integration in Gastrointestinal Host Cells using Patient Gastric-Derived Organoids. Globally, there are 16 million deaths attributed to COVID-19. In the US alone, 966,000 deaths, and with 79 million infections attributed to COVID-19. Past study demonstrated that all human organs, especially the GI lining epithelial cells, are susceptible to COVID-19. The most common GI symptoms of COVID-19 infection appear before the pneumonia are diarrhea, vomiting, abdominal pain. The highest risk for COVID-19 related mortality and mortality is due to the GI cancer subtypes. COVID-19 has been detected in immune swab, lumen, that express the receptor that COVID-19 uses to gain and enter into the cells. There are disparities in COVID-19 incidences and mortalities among and within subpopulation in relative to minority gender. The overall goal is to determine the spatiotemporal dynamic underlying COVID-19 interaction with host cell machinery for designing targeted antivirus intervention drugs. Aim 1, delineation or trajectory of spike protein in gastroparenchymal cells. Aim 2B is to examine the cytokine secretions elicited by COVID-19 spike protein infections of gastromembrane of apical and basolateral using injections and infection technology. The 1A illustrates patient gastric organoids were microinjected and infected with COVID-19 spike protein. Fig B, validations of the prepared organoids. Slide C illustrates the method of injection. Fig D, a micrograph with spike protein in the lumen or the apical and basolateral membrane. Fig 1, again, is the method of injection and infection of COVID-19 spike protein. Fig 2 is the close-up of the micrograph of internalized spike protein in apical membrane. Note the abundance of spike protein as indicated by the arrow. Fig C is the close-up of a microgram of internalized spike proteins. Note the less abundance of internalized spike protein in the basolateral membrane compared to the apical. And Fig D is the Western blot result indicating the expressions of spike proteins obtained by microinjection in apical membrane versus no expression in basolateral membrane by infection. Graph E indicates the secretion of interleukin-1 beta was highly expressed with microinjection. Graph F actually indicates when we block the actin, the interleukin-1 beta actually decreases. Fig G actually indicates the enteric infection of COVID-19 is through the apical membrane and translocated into the basal membrane to infect other circulating and neighboring cells. This study revealed that COVID-19 virus primarily entry into the gastric cells is through the apical membrane and translocate to the basolateral membrane. Microinjection of the spike protein elicited a time-dependent stimulation of interleukin-1 beta secretion. Microtubule-based mobility might be involved in COVID-1 virus spreading into the surrounding and the circulating. Enteric infection model system established here will provide a valuable resource and a platform to screen a target treatment for COVID-19 variants, infectivity, and host susceptibility.